Hello and good morning. Welcome everyone to another edition of the Hindu's Wellness webinar. This edition is being organized in collaboration with We Little. I am Pon Vasant. I work as a senior reporter for the Hindu. Our topic for today is sleep disruptions among children. We all understand how important sleep is. However, it is a big question if all of us are getting not just the right quantity of sleep, but also the right quality of sleep. According to Stanford Healthcare, sleep disorders in children and adolescents are common, and even infants can face it. It says the poor quality or quantity of sleep can lead to other problems, including academic, behavioral, developmental, and social difficulties, and other health problems as well. And a study published by the journal run by American Association of Family Physicians in 2014 indicated that up to 50% of children could be facing sleep-related problems of various types and degrees. So it is an important topic on which there is a need for a lot of awareness. And for that, we have with us two doctors who are experts in this field with us today. Dr. Shifa Shamsuddin and Dr. Umakant Katwa. Let me take the pleasure of introducing them to our viewers. Dr. Umakant Katwa is a pediatric pulmonologist and pediatric sleep specialist at Boston Children's Hospital in Boston, USA. He is a teaching faculty at the Harvard Medical School in Boston. Dr. Katwa did his MBBS at Karnataka Institute of Medical Sciences and later did his pediatric residency at the prestigious All India Institute of Medical Sciences in New Delhi. He went to the US in 2002 and did residency training at Weill Cornell Medical School and did his fellowship training in pediatric pulmonary and sleep medicine at the Harvard University in Boston. He is also an adjunct faculty at Tufts University School of Dental Medicine. He is currently the medical director, Sleep Center at Boston Children's Hospital. His research interests include infant sleep apnea, impact of breathing on craniofacial development, phenotyping sleep apnea in children, sleep endoscopy, and the use of technology in evaluation of sleep. He has delivered a number of lectures and has extensively published in peer-reviewed national and international journals. He is the present president of the Sleep Chapter of the Association of American Physicians of Indian Origin, and also a member of the American Academy of Sleep Medicine and a diplomat of American Board of Pediatrics. We are so happy to have you, Doctor. Welcome to the webinar. We also have with us Dr. Shifa Shamsuddin. She is a preventive pediatric dentist and the founder and director of Wee Little Hospital that has its operations now in Chennai and Coimbatore. She completed her bachelor's in dental surgery in 2006 and then her master's in preventive and pediatric dentistry in 2009. After practicing in few leading dental care centers, she started Wee Little in Coimbatore first in 2012. Her interest in myofunctional appliances took her to the Myofunctional Research Company in Australia in 2013, where she gained a deeper understanding of myofunctional therapy. In 2017, she received a certification from the Tongue Tie Institute in Australia. In 2019, she completed a mini residency in pediatric sleep at Tufts University in Boston, and later went on to finish a fellowship in dental sleep medicine at the same university in 2020. She's the first person from India to become a diplomat of the American Board of Dental Sleep Medicine. Dr. Shifa's focus is on preventive, non-invasive therapy. She is an advocate of breastfeeding and its role in the optimal development of craniofacial component. She is a member of the American Academy of Dental Sleep Medicine, International Consortium of Oral Ankylofrenula Professionals, International College of Cranio-Mandibular Orthopedics, and the International Association of Orofacial Myology. It's a pleasure to have you, Doctor. So the format of discussion will be that Dr. Katwa and Dr. Shifa will be making their presentations first, one after the other. And after that, we will be taking questions from our viewers. So those who want to post a question can post that in the Q&A box of this webinar. And I will be posting that question to the doctors on your behalf. So first, let me take the pleasure of inviting Dr. Katwa to make his presentation. Dr. Katwa, over to you.
Thank you. Good morning to everyone. Ponsan, can you hear me?
Yes, Doctor. Loud and clear.
Let me share the screen before I start talking. Give me 1 second, okay? Can you see the screen?
Yes, Doctor, we can see.
Okay, good morning. Thank you for having me, the Hindu group of Wellness Series and Shifa, who I know her since she came to Tufts University to do the dental mini residency in sleep medicine. Today, I'll be talking about importance of sleep in children and also cover the importance of sleep in overall in everybody, basically teenagers and adults, and a little bit focus on sleep apnea in children. So I'll be speaking close to less than 30 minutes. But let me begin with this is Harvard University in Boston, and this is my hospital where I work. So let me begin with what is sleep, right? So we all talk about sleep is very important, that we sleep, and if you don't sleep, you have bad health. But how do you define sleep? So there is not a single definition or a single function of sleep which you can define in one sentence. So how I see sleep is a process, is a state of reduced consciousness where the person or the species sleeping becomes unresponsive to the environment, doesn't respond. That process is reversible. That means it's not irreversible. If it's irreversible, you probably are dead or you are in a coma. It is reversible, and it has a homeostatic process. So what do you mean by homeostasis? Homeostatic process means, for example, if I'm awake for 12 hours, I don't feel that much sleepy. If I'm awake for 24 hours without sleep, I'm sleepy. If I'm awake for 36 hours, I'm more sleepy. If I'm continuously awake for 48 hours or 72 hours, I'm extremely sleepy. So the more you are awake, the more sleepy you become. That is the homeostatic process. And the more you sleep, the less sleepy you become. For example, if I sleep only 3 hours, I don't feel great. I'm still sleepy. If I sleep 7 to 8 hours, I'm less sleepy. So that's what it is, homeostatic process. So it's an awake and sleep a reciprocal effect. And it has a species-specific position. For example, humans cannot stand and sleep. Some horses and other animals can stand and sleep, but the humans cannot stand and sleep. So they need to be lying down. For example, certain species like mammals, particularly aquatic mammals, like dolphins and whales, have hemispheric sleep, meaning half of their brain sleeps and half of their brain is awake. And when they are migrating in the oceans, depending on the climate change, to cool from cooler water to warmer waters, they have to keep on swimming from miles to miles on days to days. So, and during that time, half of their brain is swimming, active and helps in swimming, and the other half of the brain is sleeping, and vice versa happens throughout the journey. So with advent of the non-aquatic life, for example, even evolution happened when the mammals started living on the ground without in the ocean, there was no need for hemispheric sleep or half of the sleep. So humans have bihemispheric sleep. That means both the right and left side of the brain simultaneously sleep. So what is the important function of sleep? Why it is so important? I think the most important function is body to recover, heal, and restore the function from the inflammation and stress of the previous day. So it's extremely important. It has an important brain cleansing effect. For example, if you study very hard or if you do very mentally active processes, your brain produces a lot of metabolite. It produces a lot of byproduct because of metabolism in the brain. And that metabolism is stuck in the neurons and it doesn't easily come out when the blood goes there. So there is a process called lymphatic system where the fluid, there is a CSF, which is the fluid around the brain, which goes deep into tissue and helps to clean out this byproduct of metabolism. And this happens only during sleep. So if you are awake, your brain does not clean up. If you sleep, your brain starts cleaning up. And that too, during sleep, there are different stages of sleep. You are in dream sleep and you are in non-dream sleep. When you are in dream sleep, particularly your brain is very active and the brain cleaning does not happen. But when you're in deep sleep, which is about 25 to 30% of your entire sleep duration, that's when the brain cleaning happens. If you don't get that deep sleep, even though you sleep, your brain may not clean up and you may not feel great the next day. So that's very important to understand. Then it has an immune function, detoxifies the body. It also helps to encode the memory. So for example, if you study for exam and you don't sleep well, or when you're studying for preparation for anything, and if you don't sleep well and you don't go into particular dream sleep or REM sleep, what we call it as, your memory may not be formed well, or it may form partially, or you may have difficulty retrieving the memory. So it's extremely important for children, particularly when they're learning, that when they study, they really need to get a good night's sleep on that day, so that whatever they learned, they can form into memory and they can recall at a later date. It's important thermoregulatory functions. It also helps to maintain the body temperature. And also it helps to quickly react, organize our thought, and think and talk about. So it's extremely important in that direction. How much sleep do we need? So sleep is a moving target. If you look at a baby, the baby is almost sleeping continuously other than wake up, feed, and cry a little bit and go to bed. So the babies can sleep between 18 to 20 hours. So as you grow older, if you look at this, the graphs here, so this graph, in the first 15 days of life, you can sleep between 18 to 20 hours. The dark part is called the REM sleep. So the babies have 50% of their sleep as REM sleep because that's when the neuronal connection, neuronal migration, and neuronal pruning happens. This is extremely important for learning and brain development. So as you age, as you go down the age, when you're 70-year-old, you need only 5 to 6 hours of sleep. So that is the reason your grandparents or like elderly people in the house, they wake up early morning, 3 o'clock or 4 o'clock, and they're done sleeping. And some people come to me and say that they have insomnia because they're only sleeping 6 hours. But the fact is, they don't need more than 6 hours of sleep. So an elderly person, more than 75, 80 years old, typically have a very less sleep, and they have a very less degree of REM sleep. So on an average, an adult needs about 7 to 8 hours of sleep, and children, depending on their age, they may need anywhere between 10 hours to 12 hours. And a teenager is extremely important, needs about 8.5 to 9 hours of sleep, not 7 hours of sleep. So sleep loss, I think it is becoming a pandemic within a pandemic. It was initially an epidemic. Now, because of this COVID pandemic, the sleep problem also become a pandemic. There are multiple surveys in US and in India that about 90 to 95% of the Indian people, if they talk about sleep, they have invariably some degree of sleep problem. Not necessarily all of them are very severe, but invariably it touches every person. However, the incidence of sleep apnea. Sleep apnea is a condition when you sleep and you breathe, your throat blocks the airway and you start snoring and you completely pause breathing and you wake up. So that is about sleep apnea. So you must have heard a lot of stories that a lot of healthy people, fit people, suddenly having cardiac arrest and dying and things like that. So most of the people, if you're very healthy and very active, if you don't get enough sleep, if you're very stressed out, irrespective whether you're very healthy or you're eating a very healthy diet or you're doing all the gym and exercises and very fit, if you don't get good sleep and your body's internal metabolic clock is not entrained and connected between day and night cycle, you can still have a lot of stress, and those patients or people are also at very high risk of cardiac disease or even sudden death. So a healthy lifestyle is just not about eating healthy or going to gym, it's also sleeping healthy. So a sleep loss pandemic is also causing an epidemic of diabetes, obesity, cardiac disease, and sudden death, particularly in our younger population, particularly if you look at this 25, 30-year-old people working in call centers and other things like that, they are having a lot of sleep and health problems. And recently, there is a lot of talk about sleep in the media. In the Hindu group itself published the sleep, India is sleep deprived in an article in 2020, Economic Times published also. And if you really look at the American media, insufficient sleep is a public health emergency or epidemic. So with advent of technology, with advent of 24/7 lifestyle, the only thing which suffers is sleep. People are sleeping at odd times. People are getting up at odd times. People are eating at odd times, which is completely out of sync of the nature, completely out of sync of the earth rotation and day and night cycle. So your internal body clock, which is trying to match the day and night cycle on earth, it's out of sync. And that's when the metabolic problems, diabetes, hypertension starts happening. It can affect all age groups, including young children. Particularly young children, when they're sleep deprived, it can affect their learning, memory, cognition, and development. If that affects, it can have an impact for the rest of their life about their ability to perform and be productive individual. In older children and teenagers, it can cause a lot of anxiety, depression, and sometimes aggressive behavior, and they can talk without thinking, and emotional dysregulations like crying, meltdowns, like social peer pressures and things like that. Young adults, particularly in their 20s and 30s, can have difficulty with focus, attention, motor vehicle accidents. You see so many young people having crash and die because they have not slept and they're driving and they're meeting accidents. They feel tired, they have poor quality of life, they suffer in their job. Sometimes they get fired in their job, they forget things in their job. So it's extremely important for their emotional well-being. In adults and elderly people, particularly who are older, it can cause dementia, memory issues, Alzheimer's, and also chronic diseases. So sleep loss affects all age groups and all underlying conditions. So now coming to what are the most common causes of sleep deprivation, particularly in the Indian society. So I was in India, I looked at the lifestyle of people. I go back to India and I also compare the lifestyle in US. So when I see that, there are a couple of things. I'm not telling you that in America, the binge TV watching doesn't exist or things like that, but I'm just trying to focus more on the Indian, what's happening now, particularly with the pandemic, when the people were stuck at home, the binge TV watching phenomena particularly became much worse with all these OTT platforms. So that has really taken off. And then there is electronic devices, computers, iPad, laptop. So you are basically connected to the world. There is no time for your mind to wind down. And then on top of that, you have studies, your exam preparation, your late night outs with friends. And particularly when your body is trying to calm down, when the sun goes down, when it becomes darker, but now you are in a bright lit environment. So you have an excessive light exposure from television, from iPad. So that light from any of the electronic devices or outside light or and anywhere you go, which is a bright light at night, actually suppresses your body's melatonin. So you don't feel that sleepy. So it gets suppressed. So then you have difficulty falling asleep. People typically have late night dinners, midnight dinners, alcohol consumptions. There is obviously on top of that, you throw in stress of life, job, finances, relationship. And then particularly there are studies showing that if the parents are going to bed late, their children invariably go to bed late. So that's what it is. So the parents go to bed early, the children also go to bed early. So they piggyback to each other. And people have various sleep schedules on different days, different time, and also on the weekdays and weekends. That leads to body clock misalignment. And particularly if you go to bed late, still you have school, still you have a job at the same time, you have to wake up early. So particularly what happens is your sleep gets compressed and you are sleep deprived. So now, what do you need to do to get a good night's sleep? So particularly, these are some of the suggestions, and doesn't necessarily mean that you need to follow all of them, but you can mix and match. Try to follow the nature. Try to follow the Earth day and night cycle. Basically, there is a reason we are on Earth. It's a 24 hours rotation, and your body is aligned to that. You have evolved on Earth, and the body is trying to, internal clock is trying to match the Earth rotation. So we need to honor those cues. Particularly if you eat the dinner, you should be eating at least 4 hours before the bedtime. That means if your bedtime is at 11 o'clock, you should have it at least 7 o'clock or before 8 o'clock. You have to have consistent. Now, doesn't mean that you have to go to sleep exactly on the dot at that time, but you have to be within that range. Regular wake up and sleep time, both weekdays and weekends. A little bit 1 hour here and there is not a bad idea, but I think some people go to bed like 3 or 4 o'clock on the weekends. On the weekdays, they're trying to go to bed at 10 o'clock, 11 o'clock. It's hard. So that is bad. Some people have difficulty falling asleep. You can take a light shower. Avoid vigorous exercise, thinking that I'm going to stress my body and make it tired. It doesn't work that way. Gentle stretching may not be a bad idea. But if you really have difficulty, I think mindfulness, meditation, and relaxations are the best way to do. Regarding naps, if somebody feel like napping is not a bad idea, particularly in Google and much of the multinational companies, there are nap pods. People go to nap for 20, 30 minutes to take a power nap because your body's circadian rhythm is giving you a downtime between 3 to 4 o'clock so that is the lowest ebb in your time and that your alertness, your mentation is not that optimal. So taking a nap at that time, if there is a facility to take nap, it's not a bad idea, but the nap should be about 20, 30 minutes. It should not be like 2-3 hours of a nap. Typically, a room has to be quiet and dark, relatively cooler. So it is very difficult to initiate a good sleep when the room is very hot. You need to have a comfortable mattress, and you need to go to bed when you feel sleepy. Meaning, if you are maintaining your time schedule pretty consistent, you will particularly feel sleepy, say, for example, 11 o'clock, right? 11:30. But if you fight that and you stay awake till 1 o'clock and then you suddenly become alert. So even though you try to go to bed at 1 o'clock, it may take another couple of hours to fall asleep. So when your body is telling you to go to bed, you should understand that cue and try to sleep. That is the best time to fall asleep and it's easier to fall asleep. You need to have a stable breathing. If your nose is blocked or you have congestion, cold, you have difficulty breathing, you cannot fall asleep. You should wake up consistently both on the weekdays and weekends. We talk about the sleep and also during awake. You should not suddenly jerk up and suddenly wake up and get going. Once you wake up, you should lie in the bed, eyes open, try to rub your hands, try to keep on your palm, try to connect with yourself, be aware of your senses. So once your mind is awake, your body is still sleeping. So organs are not completely awake. So you need to give some time for your system to wake up and become alert. then stretch a little bit, and then gently wake up. So that also gives time for your body to prevent those jerks and prevent, like, somebody is sleeping and suddenly flipping them off the room or putting cold water. Those kind of things are really bad. So you really need to allow the waking process to be a gentle process so that you can wake up, so that along with you, your whole body wakes up. And the Indian Society, in the recommendations from the National Medical Journal of India, when they recently revised their policy in 2017, which they did after 15 years, they talked about all other health, but they completely forgot to address about the sleep health. So now there is a push to include sleep into their next document, so that all the people are aware of sleep. You talk about regulation of work hours, timing of work, so that the people are not overworking or underworking, for that matter, particularly night shifts. You should train the doctors to know about sleep disorders in all and identify and treat them. Train medical students also in sleep medicine and establish sleep centers, and also do research of impact of sleep disruption and how much that is contributing to the current pandemic of diabetes, hypertension, and all the chronic diseases happening in India, and particularly motor vehicle accidents. So now let's switch the gear from sleep to normal breathing. So I'll take another 10 minutes. Sorry about that, a little bit longer I took. Normal breathing is quiet through the nose, is rhythmic and regular. It is vagally driven. That means you have a less stress in the body. So the benefit of nasal breathing is when you breathe through the nose, your air gets humidified. It filters the air. It also reduces the stress. Mouth breathing is more stressful and nose breathing is less stressful. When you breathe through the nose, you tend to breathe with your diaphragm and you breathe with your abdomen. It reduces the turbulence. It in itself stimulates the respiration so that you can take a bigger breath. And also you inhale the nitric oxide from the sinuses, which is very helpful to open your airways and blood vessels, and also helps with the brain cleaning. If you nasally breathing during sleep, it has an better impact on the brain cleaning, and also helps to form memory. So it is as simple as that, when you show up a child or a person who's mentally retarded or dumb, you always show that person in an image with the mouth open, like, mouth open and looking like that. So that has invariably become, unfortunately, a sign of dumbness. But there is truth to that. A child who is having developmental delays or mental retarded tend to breathe mouth much more than a child who does not. Meaning, if you breathe through the nose, it has actually published research that it also helps you to encode the memory and remember things much better than if you're breathing through the mouth. Here is a child who is sleeping, and during sleep, the child is having difficulty breathing, and you can see the chest wall moving in and out. That is an abnormal breathing. This child's mouth is open, the child is snoring, and this child airway is blocking, and the child has trouble breathing. And this child is going through a lot of stress in the body. The stress hormones are higher up, and the kid is sweating. That is not normal. Mouth breathing is not normal. Snoring is abnormal. If you're breathing very fast or shallow, or this kind of seesaw breathing is not normal. If you stop breathing, it's not normal. If you're having this choking, gasping, arousal is not normal. So anything which affects breathing also affects sleep is not normal. So, and then coming to the obstructive sleep apnea in children is a disorder of breathing during sleep. It can happen because of obstruction in the nose, in the tongue, in soft palate or tonsils, or the deposition of some fatty tissue in the airway can block the airways. So when your airways become smaller, you cannot breathe. When you sleep, the airway collapses. It completely collapses. You become apneic. Your brain wakes up for you to take a big breath. So the moment you fall back to sleep again, your airway closes, your brain wakes up. So you are waking up, sleeping, waking up, sleeping. So that continues to sleep fragmentation and ultimately leads to ill effect of your sleep deprivation. It also reduces the oxygen to the brain and rest of the body. It also has difficulty bringing out carbon dioxide, and ultimately leads to sleep fragmentation and all the ill effect of sleep apnea we talked about. So that leads to poor attention span, learning difficulties, ADHD or hyperactivity, and poor school performances. So if a child is not doing well in school, or a group of children who are not doing well in school, one of the things you really need to evaluate, in addition to other things, is sleep apnea. Number one, is the child getting good amount of sleep? Is the sleep quality good? Does the child have sleep apnea? Because treating sleep apnea and snoring itself can impact the learning of the child, and it's very important. Mouth breathing is extremely underdiagnosed. People think it is normal. Mouth breathing is the first early sign of sleep apnea, that if that child is not treated, eventually becomes sleep apneic. If not as a child, but definitely as an adult, becomes sleep apnea. So mouth breathing affects the jaw development, face development, and dental development, leading to narrow dental arch, small mouth, overbite, cross bites, crowded teeth. It can also cause small and narrow nose and nasal blockage. So it has overall ill effect on the way you look also. It also affects the tone of the muscles of the tongue, leading to low muscle tone and airway collapse. It also affects your swallowing and speech. These people have difficulty pronunciation certain words, and they have difficulty swallowing certain solids. And subsequently, they have a poor abdominal body posture with the stooped posture and hunchback posture with the neck forward, and they have small airways. Ultimately, mouth breathing leads to small airways and sleep apnea. So this is a child who on the top here was a 4.5 years old, having a nice dental arch. The child was mouth breathing, but this open bite is because the child was using sucking for a long period of time. And you see this arch, this maxillary arch become narrower and narrower. And you see this whole jaw from 4 years to 5 years continue to mouth breathe. And this child completely looks with a high arch palate, narrow maxilla, and his craniofacial growth has completely become normal. This baby was not genetically determined to look like this. This child, because of mouth breathing, did not develop the way it was genetically programmed to develop. So that becomes a deficient skeletal growth, leading to abnormal craniofacial growth, leading to more sleep apnea at a later date. So a child who is nasal breathing can have a nice square jaw, has a nice forward chin, and very square looking face. If a child continues to mouth breathe, you can see this chin is retruded. You see this angle here, the chin is smaller. And some of these people have a small chin. The growth is goatee beard and try to hide that, and it's not apparent. But small chin leads to backward movement of the tongue. And when you sleep, the tongue can close your airway and cause sleep apnea. So a child like this can become an adult like this, can have sleep apnea for the rest of their life. So a childhood is an early indication that you can fix it and prevent development of sleep apnea at a later date. The global prevalence, about 1 billion people, 1 billion people in the world have sleep apnea. About 500 million have moderate to severe sleep apnea, meaning they need treatment right now. And the highest prevalence is in China, US, Brazil, and India. So India, even though we are not overweight, we are not obese, our craniofacial structure, our body habitus, and the type of obesity you see in the Indian population with the abdominal obesity increases the risk of sleep apnea, and hence increases the risk of underlying chronic conditions, which is a direct impact of sleep apnea. What are the symptoms for parents? You should know night symptoms like snoring, apnea, mouth breathing, restless sleeps, and sleeping with the neck extended and sweating. And daytime, they have difficulty focusing, sleeps, headache, hyperactivity, attention deficits, school performance issues, aggressive meltdowns, chronic cough, anxiety, depression can all be symptoms of sleep apnea. So it's important that you talk to your doctor and try to get it treated. Causes of sleep apnea: if you have a big tongue, you have fat deposition in the tongue here, you have big tonsils, you can see these tonsils here. These are adenoids in the nose, and sometimes the nose can be blocked because of the turbinates and allergies can lead to sleep apnea. So these are some of the causes, not necessarily all the causes. And some of the times you have a narrow mouth with overcrowding of the teeth can be an indicator that you may have sleep apnea. So if you look inside, now when you're sleeping, I put a scope in the nose and try to look the airways, and this is your voice box, and you can see this airway is closing. This person is sleeping, and you see this airway is closing. That is causing sleep apnea. And there is another child here who also has sleep apnea, and then this airway is also closing. So this person is having choking on himself. He's unable to breathe, and that's also causing sleep apnea. So it's very important that if you have sleep apnea, the airway completely closes, this person is unable to breathe, he has become completely apneic, and then his brain has to wake him up as a defense mechanism. See, now he wakes up, his airway opens up, and now he takes a big breath. Without that awakening, he may probably die in his sleep. And that very commonly happens in people who die in sleep. And you also see the MRI studies, and sometimes these airways are closing and completely collapsing in the airway. It can also, we talked about some of the side effects of sleep apnea. Sleep apnea can also affect growth hormone, because your growth hormone secretion, which is important for your growth, happens only during sleep. If your sleep is fragmented or disrupted because of sleep apnea, you have reduced growth hormone, and that can also cause short stature. It can affect the child's height. So it's important we treat sleep apnea. And there are studies in the US that untreated sleep apnea, some of the brain cells in particular areas of the brain, in the frontal lobe and the parietal lobe, can be permanently reduced. That means even though you treat sleep apnea after 4 or 5 years, some of the brain tissue is permanently reduced that you may not completely recover the child's ability to do well in life. So treating sleep apnea early is important, because if you treat late, it can have an impact that you may not completely recover from, especially the effect on the brain neurons. So how do you diagnose? You diagnose by sleep study or video recording if you have a cell phone for 5 minutes or 2 minutes, and a history. And this is the sleep study, what we do in the US. See that he's snoring now. This is the sleep study, how it looks, and this person is sleeping here in the video. And now his airway starts collapsing. He's going into deep sleep. Now he's become quieter. He's actually in trouble now, because we think he's become quieter, that he's doing well. So his airways are so narrow that he's barely able to move air. He continues to be apneic, that his brain is trying to wake him up. He's not still waking up. And he's apneic now. He's barely moving air. He's a little bit, that sounds to that straw-like airway. And then his brain wakes up. So that's the arousal. That's the awakening, that he takes big breath and goes back. That is very disruptive for your health, for your well-being. So this is happening night after night. So how do we treat it? We treat with medications, weight loss, avoiding sleep deprivation. In some patients, you need surgery like adenoids and tonsils. Some patients, you need jaw surgery. Some patients, you need treatment with a palatal expansion, seeing a dentist or an orthodontist. Sometimes you need CPAP therapy like adults. You need to do breathing training like nasal breathing, pranayamas, and all those things will definitely help to improve the nasal breathing. And some oral myofunctional exercises like tongue, face, oral exercises can also strengthen the muscles, make it stronger so that they don't collapse. So that's also very helpful. How do we prevent it? To prevent sleep apnea, it should start right from the pregnancy. That means if mother has sleep apnea, that has impact on the fetus movement, and fetus jaw tend to be a little smaller. So to prevent sleep apnea, you should start pretty early and prevent preterm delivery. You can also encourage breastfeeding. The child who breastfeeds exclusively have a less risk of sleep apnea because they have a nice jaw development. Avoid bottle feeding. Avoid pacifier or thumb sucking for a long period of time. You should avoid excessive processed diet, like very soft diet you should avoid. You should allow child to eat homemade food properly and swallow. So chewing is an important exercise for jaw. Also, identify if the child is mouth breathing and snoring, bring to the doctor's attention, get it treated early, and encourage nasal breathing and jaw exercises. So this is my last slide. Take-home messages. Restorative sleep is very critical for good health and in short term and long term. COVID has in fact worsened the sleep problems globally. Abnormal breathing causes freeze fragmentation. We talked about it disrupts the sleep, has impact on the mental and the physical well-being, not only immediately, but also on the long term. Remember, snoring and mouth breathing is not normal. And snoring and sleep apnea causes difficulty with school and all the things we talked about. Early treatment before 5 years of age has the best impact on the resolution and prevention of the recurrence. And prevention of sleep apnea starts right from the pregnancy. That means you have to address the mother, and then the fetus is affected, and then ultimately from birth onwards, certain things needs to be done so that you have an appropriate craniofacial development. Your jaw muscles and everything are properly developed. Your airways are pretty big and nice so that it can impact your breathing during the rest of your life. Thank you.
Thank you so much, Doctor. Thank you for that very comprehensive presentation. It was not only enlightening, but a bit alarming as well. particularly the prevalence of sleep disorders among the population. It has certainly made me concerned about my own sleeping pattern as well. A lot to think about. We have few questions coming in, but we will have that after Dr. Shifa's presentation. So let me invite Dr. Shifa to make her presentation. Dr. Shifa, over to you.
That was an amazing presentation, Dr. Katwa. As usual, I get really lost in your presentation. It's always been a delight to hear you lecture. And thank you very much for accepting to do this. And when I heard your lecture back in TUPS, I really thought someday we need to bring this to India. The population here should know. Unfortunately, we are still fighting first world diseases. We just eradicated polio now, and we are having our own issues with handling the pandemic. And with such huge problems, something that's killing us every day, something that's subclinically happening, we needed to get this awareness. And I'm so glad you were able to join us. And thank you very much for this opportunity, The Hindu. I'm Dr. Shifa Samshuddin, and I'm a preventive pediatric dentist. And sleep has been always an area that, in fact, I would say sleep chose me rather than I choosing sleep. So being a pediatric dentist, I never knew that 10 years down the lane, I would be sitting as a super specialist talking about sleep. So I went ahead and became the first pediatric super specialist in our country to finish the American Boards of Dental Sleep Medicine. I have special area of interest in pediatric sleep and oral function. So I'm going to talk to you a little about what is a dentist role. So Dr. talking about the importance of breathing through the sleep. So I'm going to take you through what is the mouth, the breathing, the mouth and body and brain connection. So through the presentations, all of us understood that it's very important, the repair and restoration, the lymphatic drainage, that is the cleaning of the brain happens during sleep is what Dr. Katwa was talking. But overall, if you look, it's only during the sleep the brain is recovering, the repair and restoration is happening. The heart is also sobering down. The stomach is preparing for the next big meal. The growth hormone is secreted and the muscles are growing, and the lung is also breathing well. So there are a lot of minute repair and restoration and rejuvenation that's happening in our sleep. As millennial parents, a lot of us as young age parents and as caretakers, and as much as knowledge in India, we have about what is the best of education that we'll have to pick for a child, or what is the best of nutrition that we have to pick for a child. We have so much awareness about the processed food and the type of food, and the vegan, the organic. Not that much knowledge we have about the importance of sleep. So if there is a child and the child is completely getting the best of access of education, the best of access of food, nutrition, healthcare, and still if you see the child has issues with any of the systems like cognitive issues, the child is not able to concentrate in class, the growth is not up to mark, they are having excessive gastric issues like either constipations or issues with digestion, or some metabolic issues like the child's metabolic rate including diabetes. It's always better we go back and look at the child's sleep. And if you look at sleep, all of us, as much knowledge we has about how much of sleep. So we all have, we all know that there's 8 to 10 hours of sleep as mid-age or adults that we need, and children will need a little more, 9 to 10 hours of sleep. We have a lot of knowledge about the quantity of sleep, but very rarely we have the knowledge about quality of sleep. So in our practice, we have this protocol of holistically analyzing a child when they come in, and most of the parents are unaware. If you ask them how's your child sleep, most of the time they tell it's good. Unfortunately, snoring is considered to be a sign of deep sleep in our area. So a lot of the parents that I interact with, and they consider, yes, the child snores, but isn't it, when you're in deep sleep, you snore, right? So this kind of myths and misunderstanding is there in our population. So I wanted to break down the sleep cycle a little for us as parents or the healthcare providers here to understand. So sleep is, it's not like we sleep and wake up. It's not like it's an 8-hour, 10-hour sleep. Inside sleep, as Dr. Katwa was mentioning, we have micro cycles. So each cycle can vary between somewhere 90 minutes, 60 to 90 minutes. So, and in that sleep, there are different stages. There are stage 1, stage 2, stage 3, stage 4, and stage 5. The stage 4 and 5 is considered the deeper stages of sleep. This is where the brain's activity, the function of learning and memory is rejuvenated. So this is the stage where it's called dream stage, wherein our body's muscles are all completely under deep stage of relaxation. We will have dreams of jumping and running, but we don't jump and run, right? So it's considered to be abnormal when we jump and run. So it's only during REM stage disturbance, certain children have kind of issues with sleepwalking or sleep talking. So this stage of sleep is very, very important. So there are so many issues related to sleep. One thing that I want to bring to notice today is something called as sleep disorder breathing. There are a lot of other things as well. So what is sleep disorder breathing? It is a collection of symptoms that happens during the night as well as the daytime. So in case you have any of this observed, and you think the child is sleeping 8 to 10 hours, maybe there is a good quantity, but in case any of these symptoms are present during sleep, the quality of sleep is kind of questionable. So let's look at some symptoms here of sleep disorder breathing, or if the child is not breathing well during sleep. So the child is abnormally twisting and turning, kicking. There is abnormal sleep position. There is a lot of teeth grinding. Medically, it's called bruxism. So there's a lot of teeth grinding during sleep. There's snoring. The child finds it extremely difficult to go to sleep. That is, it takes about an hour, more than half an hour after the child hits the bed to fall asleep. You can hear that the child has difficulty in breathing. There is salivary drool. So children who are potty trained, so children who are beyond the age of 4 or 5, they still have bedwetting habit. That's called enuresis. There is frequent awakening. Some children wakes up in the night and finds it difficult to go back to sleep. They keep their mouth open during the sleep. And they sleep walking, sleep talking, and sometimes, as Dr. Katwa was showing in his presentation, cessation of breath or visible apnea. That is, visibly the child stops breathing and goes mute and then snorts and wakes up again. So any of this, if you are observing, then probably the child's quality of sleep is not really good. So not all children will have all of the symptoms, but even if you have 1 or 2 of this, it's always better to have a preventive checkup, because what we've repeatedly heard is prevention is always better when it comes to apnea, and catching them as young as before 5 years is always safer, because we can prevent a lot of permanent damages done to the child. Now, if a child is going to have this low quality sleep in the nighttime, how is it during the daytime? So it's so opposites, like how as adults, if we don't get enough sleep, if our sleep quantity is not that good, if we don't have a good quality of sleep, we'll wake up to be sluggish, or we'll wake up to be so tired or bored. It is so opposite with children. They will have an extreme hyperactivity pattern. So if they're not going to get good quality of sleep, they'll be extremely hyperactive, aggressive, irritable. They'll have issues with memory and learning. They'll have issues with behavioral issues with other children. They could be extremely withdrawn in terms of communication. They also tend to keep their mouth open through the day. And this is something that we'll all have to probably look at. Unfortunately, the healthcare system in a way works where we don't go into the root causes anymore. A lot of children with ADHD, that is attention deficiency or hyperactive pattern, are labeled, are given certain sensory labels, are put on system and therapeutic ways. However, it is better to also go back and look at their sleep and see if it's their sleep quality that is actually leading the child to, behave certain way. And in our practice, when we help these children to re-establish their breathing function and re-establish their craniofacial growth, we always see that they end up becoming more calmer, more attentive, and more interactive. And we've had children that go back to non-specific, non-special school to regular school as well. So why is that snoring is very important? This is how when you're lying down, the normal breathing should happen. So when there is snoring, it's an indication that the windpipe is kind of obstructed at various levels, and this obstruction is making it very difficult for the air to pass through the windpipe, and that interruption of air is what we hear it as snoring. So snoring is not an indication of deeper stages of sleep. Snoring is an indication that says that the oxygen supply to your body, the oxygen supply to your brain is cut off at various levels. And when the abstraction is complete, it's not partial, or the collapsibility is complete, is when we stop breathing. And that's what doctor was talking about as obstructive sleep apnea. So this is a child. If you can look at the child is having an open mouth breathing, shallow breathing, takes a pause, gasps for air, and wakes up. So this happens in multiple cycles. So wherein when you're mouth breathing and there is an obstruction, there's shallow breathing, and then you suddenly pause for a second and then you wake up. When we are doing this, so there is multiple wake ups. So the body and the brain is trying to keep the airway intact, that is to help the body breathe. So the child unfortunately cannot go into the deeper stages of sleep. That is the deep stages where we were talking about, where the brain memory is established, and it's the deep stage where the muscles are all completely relaxed. So when there is mouth breathing and when there is obstruction of snoring and cessation of breath, as a protective mechanism, children cannot enter the deep stage of sleep. So if they don't enter the deep stage of sleep, that is when they wake up, they have an array of issues. Like they have issues with brain functions like learning, memory, cognition, irritability, hyperactivity. So all this happens. Now, why is this connected to the mouth? So for us to breathe well, we need a jaw that is U-shaped. When we repeatedly spoke about mouth breathing, you saw that the jaws that were narrow, the mouth that is collapsed, and the children are breathing through their mouth and the nose is kind of collapsed. But for us to breathe completely healthy through our nose, our upper jaw should be U-shaped. For this upper jaw to be U-shaped, we need a scaffold, to go up there. This scaffold, if it is not functioning well, the upper arch collapses and becomes crooked. The tongue is the scaffold. So when we're all not eating or speaking, the tongue should sit in something called as a resting position. That's on the upper jaw, something like this, completely on the upper jaw. The tongue goes up the jaw, sits completely. When we get this, when we achieve this position of the tongue completely going up, we get a naturally U-shaped upper jaw. So when your upper jaw is U, the teeth are naturally aligned out. What is one more very important thing is the upper jaw is the roof of the mouth. If you look at open the mouth, the upper jaw is the roof of the mouth, but it's the same bone that is the floor of the nose. So this is what we call as high arched palate. This part of the bone is called the palate. We want this part of the bone to be U-shaped. But if the tongue cannot go up there, and if the scaffold is not happening well, the upper jaw starts becoming narrow and V-shaped. So this is the upper jaw. It starts becoming narrow and V-shaped. Can you see that if the upper jaw becomes narrow and V-shaped, the nose space is also occupied, right? So the nasal space also reduces. So the upper jaw, which is the roof of the mouth, also the floor of the nose, if it's not U-shaped, if it's crumbling, if it's narrow, it makes it extremely difficult for the child to breathe through the nose. And you saw that for all the sleep disordered issues, including obstructive sleep apnea, the tip of the problem starts with improper breathing. So you have to breathe through your nose. If your jaws are collapsed, it becomes extremely difficult for us to breathe through the nose, and we end up breathing through the mouth. Mouth is to eat, nose is to breathe. Mouth doesn't have filters. Nose has specialized filters. And if you're going to breathe through nose, these specialized filters takes away the dirt from the air. The nose also has a special ability to secrete an antiviral component gas called nitric oxide. So when we breathe through our nose, we have a natural ability of antiviral effect from the nose. So looking at the pandemic's perspective, why do some people are more prone for the disease, and why does that some people, even if they get an exposure, they don't develop the disease? There is a little bit of immunity and defense mechanism. And one of the defense mechanism is the nose. So if you can breathe through your nose and the nitric oxide secretion that our body by nature has, protects and corrects the virus at the nose level itself. And a lot of children who are mouth breathing not just has the issues of crooked teeth or crumbling, it is beyond aesthetics. So all that we know is, okay, if the mouth is open, there is a high chance that the child is going to get crooked teeth. But this crooked teeth or this jaw collapse plays an important role in the quality of the child's sleep. One thing that is very interesting is when I was doing my study and came across an article on the evolution of human head, what we are starting to notice, the prehistoric head, like in this picture, never had narrow jaws, never had issues with windpipe collapse, never had issues with tooth loss. Can you see this is modern jaw? This is like skull studies. And if you see how much of tooth is lost here, the prehistoric skulls had tooth still intact, had the jaws wider, had the windpipe wider. So there was some preventive aspect that the prehistoric humans had, which we don't have now. So what is that? Is breastfeeding. So the nature's elixir to healthy life, the first step to help us breathe well, to have a good quality sleep starts from breastfeeding. This is an image that mimics how is that you're breathing when you're breastfeeding or when you're bottle feeding. When we are feeding from the breast, the jaws, upper and lower jaw works, downward, forward and backward. It's like an exercise that we're doing for our jaws, which stimulates the jaws to grow forward, wider and U-shaped. And as we are breastfeeding, we also become predominant nasal breathers. If we have optimal level of breastfeeding, no matter what, we breathe through our nose. Unfortunately, it's not so for bottle feeding. Though bottles are considered life-saving, like there are children who are born with threatening issues where they cannot feed or where they cannot get the access to breastfeeding. The bottle feedings and formulas are life-saving. Unfortunately, right now, it's available almost over the counter everywhere. And we don't have this amount of information of the slow issue that bottle feeding can actually cause us. So when we are drinking from the bottle, we are inducing mouth breathing. How is that? Because the way the mouth function and the tongue functions for bottle feeding is completely different from that of breastfeeding. For a bottle feeding, the tongue doesn't have to move. The tongue is pushed downward, and all that the child will have to do is do some nibbling motion of the cheek muscle or just open and close. So by introducing bottle, we are inducing or teaching the child to learn through mouth. Now, this is how normally our jaws grow. Normally, our jaws grow downward and forward. But what happens when we breathe through our mouth? The jaws start growing downward and backward. So the simple thing of keeping your mouth open, non-mindful breathing, be it while watching TV, be it while sitting in online classes, be it while sleeping, be it while activities. If the child is predominantly breathing through their mouth, they might have a tendency for not just jaw crooked teeth, but the jaw themselves will start growing longer and backward. So we all know the windpipe sits just behind the upper jaw. So when your jaws are growing narrow and backward, the windpipe also tends to collapse. And now the entire vicious cycle that we were speaking from morning, when we start breathing through our mouth, then we don't go into deeper stages of sleep. Then there is a huge risk of developing snoring in future and also developing obstructive sleep apnea in future. So this is how Dr. Katwa was showing the same picture. When we breathe through our mouth, our faces tends to become long, narrow, and backward. Unfortunately, there's something by nature called buccal pad of fat that we all have to promote or to protect the head and neck, and also to promote breastfeeding. This fat pad is there in children up till 5 years. It's only after 5 to 6 the fat pad starts going off. Lot of time parents realize the face is changed only after the first tooth is fallen down, that between 6 and 7 years. Would have started growing this way, long face, even before that. And it is only evident when the fat pad is lost. So as young as in 1 year, if you get your preventive checkup done, you know if the face is growing in the right direction. If the face is growing forward and wider. And to get a face like this, forward, wider, a windpipe that is healthy is what we are looking at achieving in getting a good sleep and cutting the cycle of sleep related issues. Unfortunately, when the sleep quality is not good, it's just not about irritability. As Dr. Karpa was saying, it affects a lot of systems like the cardiovascular system. The cardiovascular load is more. A lot of us are prone for developing metabolic issues like diabetes, neurocognitive issues like hyperactivity, and also dental issues. So when we don't breathe through our nose, mouth breathing, we are so hugely prone for developing a lot of cavities and crooked teeth. And by just establishing proper breathing, you can get straight teeth naturally and cavity-free mouth naturally. So it's very important. So this is how I told you the tongue moves up the jaw for breastfeeding, making the entire craniofacial complex, your upper jaw, your brain cavities, your jaws grow wider and forward. But bottle feeding tends to push the tongue downward and backward, thereby inducing mouth breathing and making your jaws completely crumble and narrow. So if your child has a tendency to sleep like this, then no matter if they're sleeping for 8 hours or 10 hours, they're not getting a good quality sleep. So what are the signs to say that they are not getting good quality sleep? When the open mouth posture is there, if they have snoring, if they have bedwetting beyond the age of potty training, their salivary drools, their frequent position change, if their teeth grinding, if they have frequent nightmares, and if they keep their mouth open, it's always worth to look into your child's quality of sleep. What happens when they have a sleep like this? They wake up to have, they are usually called as tough children. They have poor concentration, irritability, mood swings, excessive daytime tiredness or fatigue. Some children wake up crying. Some children, it's extremely grumpy after they wake up. They have unexplained headaches on waking up, or earache or dry mouth. And they also have crooked teeth and tend to keep their mouth open through the day. So this simple question of what is the cause of crooked teeth? What can I do to help children go braces free? So braces is a mechanical way of fixing teeth, but it doesn't correct the cause, the reason of why crooked teeth has happened. Most of us, I think that crooked teeth is genetics. Just like how diabetes or cardiovascular disease has a genetic base, but it's because of lifestyle. Crooked teeth is also not genetics. You saw the prehistoric studies, right? Prehistoric humans never had crooked teeth or never had cavities. So this little study, like a maze, led me to what I'm doing now. So as I started helping children get straight teeth naturally, we saw that when they perform the exercises, when we do work on their jaws to expand, their sleep quality naturally became well. I'm going to show you a few children, how we went from correcting the jaw growth just with exercises. We call this orofacial myofunctional therapy. It goes a long way because we're catching them young. These exercises does magic to them. This child had sleep quality issues, open mouth posture during sleep and day. Can you see if she has to keep the lips open? There's a lot of tension there. She went from here to here only with orofacial myofunctional therapy, that is exercises. It just not helped her get a good U-shaped jaws, but it helped her breathe comfortably through nose. Once we established the nasal breathing, her sleep quality tremendously improved. This is another child, crooked teeth from here to here only with exercises. And you can note that the children are from global platform. We have children from across the globe, and because the therapeutic base is predominantly, the work that we do is predominantly exercises, we could see them online too. This child, frequent cold cough allergies, thumb sucking. So all of you will have to note that if a child is thumb sucking, it is not for behavior. It is it might be for self-soothing, but there is always a doubt that is the child thumb sucking as a defense mechanism. So a lot of children thumb suck to help them breathe better during sleep. So it's always better we get it evaluated if the thumb sucking is a child's adaptive defense mechanism to ensure that the child is breathing well while asleep. So he was thumb sucking. What we noted was he's a predominant mouth breather, open mouth posture, frequent allergies, was on allergy medications, and after we got his jaws and jaw muscles strengthened with exercises, after we helped him strengthen his jaw muscles and help him breathe through the nose from here to here only with exercises, and the child is in soccer team now, he plays soccer, all his allergies are gone, he didn't want to thumb suck anymore once his jaws were comfortable to breathe well. So from here to here only with exercises, and most of these children have this mid-face deficiency. If you see, this part of the face is like flat, which is a huge indicator for us when we look at the child that, okay, the child is keeping the mouth open while sleeping. Can you see the long face from here to here? We corrected the breathing only with exercises. The open mouth posture, long face, as Dr. Katwa was mentioning, most of the time an open mouth posture is an indication of a dumb child. So the moment we think of a child that is not cognitively capable, this is the face we remember. Once we help the child breathe better from here to here, naturally, all that we did is help his muscles strengthen. And this is how his natural growth should have been, optimal growth, had he had stronger muscles of his mouth and was he breathing through the nose. So just establishing nasal breathing, not only that his facial aesthetics improved, his teeth alignment, bunny teeth is gone, but his sleep quality tremendously improved. So there are a lot of children that's benefited this way. And thank you all very much for patient listening. So I do write blogs. These exercises, simple exercises that you can perform at home, are there on my websites and blogs. My website is drshifa.in, and those are my Instagram and FB handles. Thank you all for your patient listening.
Thank you. Thank you so much, Doctor, for the detailed presentation and clearly explaining the connection between breathing issues and the craniofacial features of the body. We have taken almost all of the scheduled time in the presentations, but it was certainly worth it because the presentations were very detailed and it has already clarified most of the questions that our viewers would have had. But there are a few questions from our viewers. Dr. Katwa, can you be with us for another few minutes?
Yeah.
Yeah.
Okay.
So I'll just, since we have very little time, I'll directly jump to the questions that we have from our viewers. There are two questions from Deepya Rao. She has asked, is sleep training good? What are the pros and cons? And she has also asked about the impact of thumb sucking. It's said to be a regulating mechanism and good till certain age. Your take. And I think Dr. Shifa already touched upon a little bit on that. But Dr. Katwa, would you like to answer the first part of that question? That is sleep training good? Can somebody go for sleep training and what are the pros and cons of it?
So sleep training, naturally, when you have a real problem, then you need sleep training. But I think following healthy practices right from the beginning may not necessarily need you to go to sleep training. So if somebody has an issue and they are having behavioral insomnia, that means post-sleeping, or child is coming and sleeping with you, or child is not falling asleep at the right time, or child is waking up multiple times, or child is waking up and coming in your bed in the night. So any child which disrupts her own sleep and also disrupts the parent's sleep should go for a sleep training. And sleep training, one training does not fit all. There are multiple types of behavioral problems in children, like bedtime resistance, that means they refuse to go to bed, or a sleep association, meaning the child needs to be held, or the child needs to be patted, or the child needs to rub, or the child needs to be taken in the car for a sleep, or to fall asleep, or a child needs to co-sleep with you, or sleep on your belly or stomach. So that sleep association, there are certain training or certain protocols we follow, or sleep hygiene issues, and we recommend to slowly desensitize the child and walk them out to these habits and then start sleeping on their own. So yes, if you have those, then you can definitely go for that. But said that, some parents want to imbibe healthy sleep practices right from infancy to early childhood, toddler age group. There are certain books people can read, and there are certain approaches people can do. And also, sleep is very cultural, right? We all grew co-sleeping, and mostly 90% of the world co-sleeps. Co-sleeping is not a bad thing. With the modern advent of society and two people joined like micro families, people value their sleep more than because they are working, both the parents are working, both the family members are working. It's important for the parents to sleep. If the child has sleep issues and the child has other issues, that affects parents' sleep and parents' quality of life. That's the reason a lot of people come to me, because they are not sleeping. In that situation, if you're a micro family or a small family, it is good to start the sleep training right from like within a couple of months after birth to imbibe that becomes a normal phenomenon rather than going backward and training at a later date.
Thank you so much, Doctor. Dr. Shifa, would you like to answer the other question about thumb sucking? The viewer has asked that it is, as per her understanding or his understanding, it's said to be a regulating mechanism and it is considered good until it is there for a certain age. So what's your take on that, Dr. Shifa?
So we will have to differentiate between sucking and oral exploration. So there is a growth stage of the child called oral stage between 0 to 18 months. And that is a stage where the child is actually exploring the mouth, taking a lot of stuff, putting in the mouth, taking the hands into the mouth, exploring. Sucking is a process when the thumb is actually put inside and a sucking performance, just like sucking on the breast, this is sucking. So a lot of parents, when they come to me, they misunderstand the oral exploration to sucking. Just putting fingers inside, fiddling and trying to figure out is not sucking. Sucking is actually putting your fingers and sucking. So there are different reasons for sucking. In broad terms, we can classify it as behavioral and anatomical. In behavioral, if the child is not gently weaned off from breastfeeding, there is no much of access to breast. The oxytocin gush we get when we breastfeed, when that is denied, there are some behavioral aspects. But what we also have to do is some anatomical aspect. A lot of children thumb suck as a compensation mechanism to help them breathe better. So thumb sucking is can also be a compensatory mechanism, whereas an indication that the child is predominantly not breathing better. One of the simplest thing is that if a child is sucking the thumb to go to sleep and finds it very difficult not to sleep without sucking the thumb, or in between the night, especially during the REM stage sleep, every 45 minutes to 2 hours, the child keeps waking up and demands feed or sucking. So this is when we have to really look into the muscle function. So exploration is different, but if there is thumb sucking, we should always have the benefit of ruling out if it's a behavioral anatomical thing. So there is a lot of myth telling that we should not interfere thumb sucking. It will cause a lot of psychological stress. So it's always safer, because as you saw in the pictures, thumb sucking can actually go a long way to make your jaws really crumble and narrow and high-arched up till so long, even into the late teenagehood. It's always better to have a complete functional evaluation and examine and get a solution.
Thank you. Thank you, Dr. Shifa. We have a question from Somya Lakshmi, who has said that her child was breastfed and they do relax the child before taking the child to bed, and we follow regular eating and sleeping habits from birth. But the child, I think, is now 12-year-old, had his tonsils and adenoids removed due to severe infections at the age of 4, but tonsils have regrown now. He talks in sleep and does mouth breathing. We are doing yoga under a trained teacher. Pranayama and tongue exercises are regularly done. What more can be done? Dr. Karpa, would you like to take that question?
So if the child has just enlarged tonsils, or the child has snoring as well. If the child has snoring, the child probably has sleep apnea. So you should watch for snoring and make some videos, talk to the ENT. So when you do the tonsil surgery, there are two types of tonsil surgeries. One, you take partially tonsils out, called tonsillectomy. So when you do the partial tonsil removal, the tonsils grow back. But if you do a complete tonsillectomy, that means the complete tonsils are removed, the tonsils don't grow back. There is another tonsils in the back of the nose called adenoids. they grow back. So if it is really a tonsil grown back, it suggests that your doctor in the first place did not take the complete tonsils out. Sometimes they only shave a little bit. So in that situation, you need to see an ENT doctor, get the nose checked for adenoids, also the tonsils checked. And if there is a sleep apnea, the first thing is probably to get the adenoids and tonsils out. And if there is allergy, treat that, and then start doing myofunctional therapy, and also see somebody like Dr. Shifa, who is into orthodontics, to see if there is an expansion or things like that. Then your mouth breathing will get better. It's a process. Unless you take the obstruction away, you may not be able to completely revert back to nasal breathing. Pranayama, everything helps, but if there is a big obstruction, that may not be that effective. But you still need to continue to do that after the surgery.
Right. Thank you, Doctor. Dr. Shifa, in your experience, I mean, there is another question from Mr. Ramachandran as well. It is also related to the effect of yoga, meditation, and pranayama, and how that helps in getting a better quality of sleep. He has said that he has cited Dr. Uma Khan saying that no middle-aged person, it's okay to have undisturbed sleep for 6 to 7 hours. But to what extent yoga, meditation, and pranayama can help? Dr. Shifa? Or Dr. Karpa, yeah, please.
Okay. So what happens is yoga and pranayama, especially there's a process when you tend to fall asleep, and there are processes which facilitate, the body is telling, your body is giving cues for you to fall asleep. So in this modern life, with 24/7, your mind is so occupied. When you try to sleep, that's the mind, when you're not doing anything, and you start reminding all the stuff happening in your life, good things, bad things, anxiety, family members' death, or whatever it is that comes to the mind. So that what leads is, when you're about to fall asleep, your brain actually, rather than falling asleep, it wakes up. It's called pre-sleep arousal. Like before you fall asleep, instead of brain becoming sleepy and sleeping, it wakes up. It becomes very alert. So when you do the relaxation technique, you do the meditation, and you do the pranayamas, when you're trying to nasally breathe, that prevents your brain, even though your mind is trying to think. When you try to do pranayama and breathing exercises, you try to focus, right? You're trying to take away the stimulation, you're focusing. That focus facilitates the sleep onset, so that instead of brain waking up, it goes into sleep. That's what it does. So once you fall asleep, then you continue to stay asleep because your mind was not thinking at the onset of the sleep. If your mind is very active at the onset of the sleep, one, you'll take a long time to fall asleep. Second, you wake up multiple times, and again, you have a hard time going back to sleep because your mind is trying to make you think that, and you're trying to fall asleep. You're a girl. So that's what your meditation, mindfulness, and pranayama helps you with.
Right. Thank you so much, Doctor. I think we're really running out of time, but there are many questions, so we'll probably take another couple of questions and we'll wrap it up after that. Dr. Shifa, would you like to answer this question? There are two questions from an anonymous attendee. What if a baby who is below 1 year sleeps on his tummy? Is that problematic? That's one question. And there is also a related question asking why some babies leave their tongue out when they're awake. Is it something concerning? Dr. Shifa?
So answering the first question, tummy sleeping itself is an indication of abnormal sleep position. So it's always better to look for other things as well. Like if the fact that the child is not able to sleep on the back comfortably is an indication of difficulty in breathing when they go into deeper stages of sleep. So a lot of children, as a compensation, picks up abnormal sleep position like hyperextended neck, side lying and hyperextension, or tummy lying and keep putting their tongue out. Is all compensatory mechanisms to get as much oxygen to the body as possible when they're sleeping. That's number one. Number two, tongue thrusting. That is putting the tongue out in between two teeth. This is called tongue thrusting. It's an orofacial myofunctional disorder. And this disorder is indicating that the muscles of the head and neck are not in harmony or not optimized. And tongue thrusting is also a compensatory mechanism to help in proper airway breathing. So if the tongue is going to collapse the airway, there are a lot of compensatory mechanisms. Some children thumbs up, some children has open mouth posture, some children has tongue thrusting. They thrust the tongue out and to help them comfortably get in as much oxygen as possible. So it's better to look into the deeper causes. So going back, we are talking about nasal breathing or mouth breathing, breathing through the nose or breathing through the mouth as just separate entity. For mouth breathing, there could be many reasons. So we cannot just ask a child to close the mouth or, seal the mouth and say, ask them to do yoga and get the nasal breathing established. So it's better we go into deeper stages, like, is there obstruction? Is the jaws narrow? Is the tongue weak? Do the child have allergies? Is the the upper and lower jaw retrognaathic? So you saw in the video, right? The upper and lower jaws are narrow. So all this, it's better we get a holistic examination.
Thank you. Thank you so much, Doctor. Dr. Katwa, there is a question from one Mr. R. Murali Krishna. He is, I think, asking about how, to what extent that these problems can be corrected when they are diagnosed much later in the life, like meaning in adults, like when they have this breathing through mouth or the lips are outside as shown in the picture, etc. So how difficult it is to correct these things when it is diagnosed at a much later stage in life?
It's not impossible, but it is harder. What happens is, it depends on the age. The younger you are, your battle muscle tone, the recovery is quicker. The myofunctional therapy becomes more effective, number one. Number two, if you've been mouth breathing since childhood, some people mouth breathe as an adult, but if you are mouth breathing through childhood, remember we showed some photos with a small chin, your face looks a little bit abnormal. If you have that kind of problem already, which had onset in childhood, and your jaw is a little bit downward and your long face, those are a little bit harder to treat. So based on what severity, you can either treat it a little sooner or a little later. So if you have mouth breather and if you have sleep apnea, then probably you should get an ENT checkup. And if there is nothing surgically to be done, you need CPAP, and then you need to start myofunctional therapy. But if you do good myofunctional therapy consistently, you can definitely reduce the mouth breathing, provided that if there is no significant nasal obstruction.
Right. Thank you. We'll take one last question. There are two viewers who have asked somewhat similar questions, and I would like to pose that to Dr. Shifa. I think both the questions concern about 8 to 10 months old babies who keep waking up in the night and they have to be breastfed frequently. And is that something concerning? Is the question asked by one Ms. Nandini N and also by one K. Meenakshi. Dr. Shifa, would you like to answer that?
So ideally the metabolism, so when we talk about 8 months and 10 months old children, their metabolic rate is really high. Once in a couple of hours feeding is considered to be optimal or ideal for this age. So there's absolutely nothing to worry about it.
Thank you. Thank you so much, Doctor. I think we can wrap up the session with that question. It was really enlightening. I think sleep is something that we cannot take it for granted. That has come out clearly during this session. Not just the quantity of sleep, but also the quality of sleep. That is very important. And one of our viewers has rightfully pointed that can we make a global change by letting schools and education department know the importance of sleep and align their timings accordingly. And it is an important message that we need to create such an awareness at schools itself. If we can do that in a country like India, I think that can bring about a lot of change. I think that's the message that we can give through this session. Thank you so much for joining. Thank you, Dr. Katwa, particularly. I know it is very late in the night and you managed to join us amid your COVID duty. Thank you so much for joining. Thank you, Dr. Shifa. Thank you.
Thank you all very much. Thanks so much, Dr. Katwa.
Thank you.
Thank you.
Thank you.